Hello, everyone. Dr. Anna Cabeca here, and we are live. We are here today to talk about Julva and vaginal health and feminine care for women, and especially addressing physicians, providers, practitioners, whatever your field of interest is. If you take care of women, you really need to hear this presentation today. So I want to go into a little bit of the science, and I'm going to talk about why I created this feminine cream called Julva. And it's an anti-aging feminine cream for the vulva, and it has been now used by over 35,000 women around the world. And we're getting continued great feedback, especially from physicians, their gynecologist or family physician in their follow-up exams. Not only that, from their mates, from themselves, just tremendous testimonials. And I'm going to share a few of those with you, but I want to get into the practice and, my 20 years as a women's health specialist and OBGYN, and some of the pearls that I've learned, and open it up at the end for some questions to be able to address those questions and answers with you specifically for your needs and your practice needs and any questions that you may have about that. So I'm going to share my slides and get started with a quick presentation. Great. So here we go. So today we're talking about Julva, and a quick disclaimer that I am a physician and that I am publishing this information for educational and informational purposes only. It's not intended as a diagnosis, treatment, or as a substitute for professional medical advice, diagnosis, and treatment. So any of the information that you hear here, always consult a local physician or other healthcare professional for your specific healthcare and or medical concerns or needs. So first of all, I wanted to find out about how many are currently using Julva. So I wanted to take a quick poll, and I know entering on that had over half of you already using Julva. So I was excited to hear that. See, my slides are a little slow to respond tonight, so I apologize. There we go. All right. So when we talk about the area of sexual health, one of the things that we talk about is that it is not a one size fits all. And there are many areas in regards to sexual health. And this has been my area of specialty over the last 20 years, and working through these 7 dimensions of what leads to improved sexual health for women. And certainly Julva, as a feminine cream and anti-aging cream for the vulva, addresses some of these issues, but there's many more when we're dealing with our patients that we need to address. And that includes physical, psychological, emotional, relational, spiritual, environmental, and medical, including medications and surgery. So it is important to address these issues for clients, and women often don't want to talk about it. So for Jest, I put up this cartoon that I love. It says, go down a water slide while it isn't wet, and then you'll understand why foreplay is so important. And in my sexual health classes and sexual CPR, I always say it starts at breakfast, right? Like, bring me a cup of coffee. And that's just a whole dimension to sexual health. So this is just one portion of it that I'll be addressing today that does make a difference in women's lives. And I'll give you a little bit about background about me. I'm Dr. Anna Cabeca. This is a picture of me and my dog Sandy. We live down here in St. Simon's Island off the coast of Georgia. And I live here with my 4 daughters and Sandy, my 5th daughter, technically. So professionally, I'm an Emory University trained board certified gynecologist and obstetrician. I'm also board certified in integrative medicine and anti-aging and regenerative medicine, an expert in women's health and sexual health. And I've specialized in bioidentical hormone replacement therapy and natural alternatives, including successful menopause, which is really my area of focus, and age management medicine. I've lectured nationally and internationally, training physicians and speaking in general to the public on sexual health issues, hormones. And I've created some solutions that did not exist for me or for my patients. And Mighty Maca was my first formula that I created, and it's a greens formula that has over 30 superfoods in it, just beautiful natural ingredients that are just really powerful combined together. And we support a foundation I opened in honor of my son called the Garrett V. Bivens Foundation. I also created Julva cream, which is the anti-aging cream for women that we'll be talking about today. And I'm passionate about education. So I've created educational 7-week programs, each of them specializing in a different area. So there's Magic Menopause, Women's Restorative Health, and Sexual CPR, my 3 signature programs. On a personal note, I'll share with you a little bit about my story. In 2006, I was 39 years old, and I had 4 children and was over 80 pounds overweight, losing my hair, stressed out, running 2 jobs, raising a family, and was significantly depressed and stressed. And I usually say I was depressed, stressed, and my hormones were a mess, and that's for sure. Really was at a devastating point in our life after our own personal tragedy in which we lost our little son in a tragic accident. So also with this grieving and post-traumatic stress, it was challenges one after the other. So I was diagnosed as menopausal, premature menopause at age 39, completely infertile, was told I would not be able to have another child. A picture says 1,000 words. So I share these pictures certainly out of mass humility. And you can see here how much hair loss I had, a significant amount of hair loss all the way to past the crown of my head, just a tremendous amount of balding, not thyroid disease, but stress-induced hair loss. And so really, intellectualizing what I was experiencing made me dig deep into underlying physiology, hormone imbalance, and the effects of stress on our body, not to mention the tremendous weight loss resistance, the upper body weight, the high cortisol weight gain that I was experiencing. But I know that, I had 3 daughters at that time, and I wanted more than to survive. I wanted to thrive. And I always say, we have our cancer survivors, but we want them to be thrivers. And it makes a total difference in our mentality. And so I worked to restore my health after a year-long journey around the world. And, between meeting indigenous healers from all over the world, I was able to lose that weight and restore not just my hair, my health, and lose over 80 pounds, but regain my fertility and, completely bump myself out of premature ovarian failure and out of premature menopause, and was fertile again at age 42, where I had my daughter, Ava Marie. So she is my miracle child, the child I was told I was never going to be able to have. And that's little Ava Marie. And not just that, just to be able to continue to live a life with purpose again, and to receive joy in my life once again, despite the trauma that we experienced as a family. So that was part of my journey, and understanding how true it is, and your patients are dealing with this too, that our soul suffers when the body is diseased or traumatized, while the body suffers when the soul is ailing. So we as physicians know so well how much soul care is needed in healthcare. And I am just thrilled to be able to share any of the knowledge, any of the pearls I've learned, and also would never wish anyone the road that I've been on to learn that I've been on to learn these things. So I want to share with you, just if you can tell me a little bit about yourself. I want to go ahead and let me switch out of this and just ask you a little poll here. And so tell me a little bit about yourself on here on the audience. If you can just, you should be able to vote. A poll just shows up on your screen. And if you can just vote. And so I can see a little bit about what your profession is, what your area of specialty is, and what field you are in. And then also, are you male or female? So I know we are getting more and more women, OBGYNs, physicians, et cetera, that are involved in healthcare and in our practices and in medicine. So I'd love to see it. So we're about 50-50 here on our male and female, which is exciting. And we have here, if I could vote, I would vote into gynecology. But we have naturopath, right, and other provider, as well as anti-aging, age management, and other field of specialty. So I just want to thank you for indulging me with this little poll that we had right now. So, all right. So I like to know a little bit about, too, like what are the most pressing questions that you or your clients may have with regarding Julva, for instance, specifically, actually. So I'll go ahead and just throw up this other poll and humor me and just think, what is the most pressing question about Julva that you may have? I often hear about, what is it? What are the ingredients? What results can our users expect? What are the typical questions that our clients will ask us? And what side effects have been experienced, as well as who is Julva best recommended for, and what feedback is typical? So other questions that I often get are, is it good to use Julva with vaginal rejuvenation procedures? And then sometimes I get asked to share my vaginal prescribing pearls. And I also was curious if you'd heard of my product, Mighty Maca. So that's my superfood product that I talked about to really help with adrenals and balance hormones. So we've got 50-50 on that. And everyone wants to hear about how it is with vaginal rejuvenation procedures, and then definitely what results. So we'll talk about results and also what our clients are saying, the testimonials and the ingredients. So great. So thank you for polling with me today. All right. So share those results. And you should be able to see our poll results. So, okay. So we'll go on in my presentation. I'll talk a little bit about the physiologic changes that are happening and as it relates to vaginal health. So I'll take another 10 to 15 minutes here, go into some of the science, and then I'll open it up for questions. So let me hit present. All right, so what's happening to our vaginal health as we're getting older? One of the things that we see is a loss in the rugations. You can see here a loss of the vaginal rugations as we're go from, the youthful reproductive age vaginal mucosa. We have these great folds and rugations and the elasticity until thinning and loss of the musculature and loss of the blood vessels. So hence dryness, loss of flexibility, increased tears, irritation, and trauma to the vaginal floor. Something people don't think about very often is tampon trauma with in the perimenopause, irregular bleeding, spotting in between cycles, and the vaginal dryness. In using tampons create microabrasions that also can affect the health of the vaginal tissue. So it's important to understand that as we work with our patient. So, and also just the thinning and the shrinkage of the uterus, as well as the ovaries and the fallopian tubes. So we lose those secretions, the glandular secretions and natural moisture with the thinning. Now, what's important to understand is when we use vaginal estrogen, the most common prescription ingredient for vaginal dryness, we have an improvement in the mucosal layer, but we don't see any improvement in the deeper layers of the vagina. So, or to the muscular layer, deeper layers of the vagina. So it's really important to understand that androgen therapy works really well to help regain the muscular vaginal walls and helps to regain the strength, elasticity, flexibility, and the rugations in the vagina. And this is what we've seen in scientific studies. I mean, it's no different than an anti-aging doc prescribing testosterone for their male or female patients and increasing and seeing an improvement in their muscle mass, as well as a decrease in their fat mass. So we want to see those improvements, and we see them in the vagina as well. It's important not to forget that, the vagina has a muscular layer as well. And so as we age in the perimenopause and postmenopause, I know this is mostly review, but we have the declining hormone levels of estrogen, progesterone, testosterone, and DHEA. We start to see that atrophic thinning lining of the epithelium, and we see the decreased musculature. Vaginally, we also see the increase in pH. The normal pH of the vagina is 3.5. And so it becomes more alkaline. And these are changes that we note, especially post-intercourse with alkaline sperm and the changes in the vaginal milieu and the microbiota of the vagina too. We can start to notice more bacterial vaginosis, bacterial vaginitis, irritation, discharge odor, and discomfort. We see a decline in the glycogen levels, hence less elasticity, and a decrease in the microbiota, the normal flora, lactobacilli of the vagina. So, we'll have changes as well on a monthly basis, as well as we'll see over time at hitting age 35, we start to see a decline in progesterone hormones. We typically see that decline first before we see the dipping of estrogen and the gradual slower decline of testosterone. But in our mid 30s to 40s, we're already seeing this decline. Also, even more so with DHEA, which peaks in our mid 20s. And by our 30s, we're also, both men and women have a significant decrease in DHEA. I prefer to think that it doesn't start to decline till our 30s. However, it is in our mid 20s that it starts to decline. And DHEA is really associated with so many good things, right? Healthy brain, bones, breast, and the research continues on. It's, our adrenals produce DHEA predominantly in the postmenopause, menopause, and andropause time period because our testicles in men and ovaries in women are also producers of DHEA. But in the menopause and andropause, those amounts have significantly declined, and the adrenals have to come in there. And that's where stress can really compound the effect of the loss of our androgen hormones. DHEA further breaks down systemically to testosterone and estrogen. So the reproductive hormones further decline and we lose those benefits. So men and women are different, right? That's something important to understand. We do things differently. We feel things differently, totally different. And again, complicated as women are, maybe men too, right? But definitely when it comes to our sexual health and our erogenous zones, et cetera, that we're a bit more complicated. So want to address many areas at the same time when we get to sexual health. So it just reminds me to reiterate that it's very complex, and women, our sexual desire curve is not linear. There's a secondary sexual response, which is actually our primary response versus men's primary response in sexual health and sexual appetite. So it's important to understand that. Now, as I go into Julva, again, addressing vaginal and vulvar health and the changes that have occurred as we've aged, just like the vaginal changes have occurred, the vulvar changes have occurred with vulvar atrophy, loss of elasticity, irritation, changes to the skin texture, tone, sensation, and also the clitoral area, vulvar area, and all the way down to the rectal and anal area. Those tissues become more fragile. And so as a gynecologist I was working. So let me just flip back into conversation mode 1 second here. And if you have a question, go ahead and raise your hand for a question, and I will be able to see that, and I can bring you on at this point. If you have a question, then I'll continue on into my discussion. So as a gynecologist, I work primarily, in solo practice. I was a National Health Service Corps scholar coming out of Emory University. And so I came to rural Georgia. I had to get very creative and cost effective in the ways I help my patients. But as a rule, I was doing 2 to 3 surgeries a week. When I started working with bioidentical hormones and functional medicine, it changed to 2 to 3 a year. When it came to vulvar and vaginal health and incontinence issues, I was doing sling procedures, got really good at the outpatient sling, and I wanted to get better and better at it. So I started using vaginal testosterone prior to surgery, and combined with vaginal prescription DHEA prior to surgery. My patients would come back for their pre-op with absolutely no more incontinence symptoms. So I was like, this is fascinating, where I was trying to get better results because I wanted healthier and healthier tissue to be able to suture and do surgery on. Turned out that we were able to reverse these problems that the patient was coming in with, which makes a huge difference in the life of a woman. I mean, the best slings in the world still have potential complications. I mean, we hear about mesh erosions, and I've treated mesh erosions, thank God, none of my own. I had none of my own. And, but mesh erosions and sutures coming through the mucosa, and work to just reestablish that by using vaginal androgen therapy to repair and restore the health of the vagina. So those things made these prescription maneuvers made a huge amount of difference in the quality of life of my patients, as well as in their results, and of course my results when surgery was necessary. But surprisingly, more and more was able to avoid surgery, and or when I did surgery, got much better results. So I think that's really powerful. One of the things was that, I retired my clinical practice in 2015. And so since 2013, I had really been trying to figure out a way to create a solution for women that was available over the counter without a prescription, because this is vaginal prescribing is a very highly specialized area. And at that time, we had no available vaginal DHEA prescriptions available. Now, Intrarosa is available, which is great. I've been watching the research from Dr. Labrie for a decade. And so the safety studies, efficacy studies, that's what was really interested in. What are safe, natural things that we can do to help women age gracefully, right? Restore pleasure and intimacy, because if a woman has pain every time she has sex, really, why would she want to have sex? That not just pain during sex, but afterwards, irritation, discharge, and those are compromising. Leaking of urine when you cough or sneeze or during intercourse, embarrassing, and creates a unspoken barrier between husband and wife, and so want to eliminate that. So understanding the areas of where vulvar atrophy has been neglected in our field of gynecology completely, I wanted to create a solution. So I'll share back my screen and tell you more about Julva and the ingredients in Julva right now. So Julva, the ingredients I put in Julva include plant stem cells from the alpine rose. Now, I love this ingredient because when I was studying, had a cosmetic line before I closed that down to focus on creating Julva. But when I studied plant stem cells for their anti-aging cosmetic benefits, right? Anti-aging youthful benefits, I found the I found the research looking at plant stem cells from the alpine rose, which is this rose that grows in the Swiss Alps and blossoms in the harsh conditions of the Swiss Alps among the ice and snow. And you see this beautiful rose that blossoms and thrives there. And so scientists had studied it for its plant stem cells and found these great rejuvenating factors that it had and benefits that it had. So the research that went into the plant stem cells showed definitely anti-aging, reducing wrinkle. There were antiviral benefits that had been published on plant stem cells of the alpine rose as well, including a reduction in HSV outbreak. So I knew this was an ingredient that for the vulva I wanted to include. And then DHEA. DHEA is that natural native ingredient to our bodies, and the research again, safety studies on DHEA has been very profound. And I knew clinically from working with many clients in using testosterone and DHEA, the benefits and the results I was seeing, and I wanted to create a transdermal. I wanted to include that in this transdermal anti-aging cosmetic cream. And so with that, I used emu oil. Emu oil is something that I found when I was traveling around the world and in Australia and New Zealand, and the medicinal benefits of emu oil has been around for centuries. And it's very penetrating, very moisturizing, very nourishing. It's been studied to help with psoriasis and eczema and really tough skin conditions. But not only that, it penetrates the skin really, really well. And I'd used it in clients with my vaginal prescriptions from an early time because I had the best results when I wetted the ingredients with the emu oil. So I include that in my Julva feminine cream. And then coconut oil. Now, we all know the benefits of coconut oil. It's good to eat and it's good to use as a lubricant, right? A natural moisturizing lubricant that in and of itself has antifungal properties, right? So there's a great reason to use coconut oil here, especially when our the vaginal areas tend to accumulate yeast over time, and that can stay dormant for a while. So coconut oil, as an aside, is one of my favorite lubricants. I always recommend for my clients to keep a little canister in their bedroom and one in the kitchen, not to mix up the two, right? Let's keep them separate places. But definitely I knew that was a must-have ingredient to it. And then shea butter was another ingredient. We don't have any actually, there's no other there's no other fragrances or anything added into it. We added shea butter, and shea butter is just, again, another great moisturizing natural ingredient that works really well in this combination. I worked for 3 years, 2 to 3 years, really fine tuning the ingredients that I used in Julva to get the best effect. And so I want to talk a little bit, though, back to what I mentioned before on the research of intravaginal DHEA and how that has been shown to help with libido and sexual function in postmenopausal women. Now, this is often a really significant issue. And again, for over 50 years in the United States, DHEA has been available over the counter, but anything inserted vaginally is by prescription. I only recommend prescription, compounded, or intrarosa for vaginal DHEA and what you can do with that. But this research showed that by local action in the vagina, DHEA applied daily at doses at which serum steroids remain well within normal limits. So we don't see an increase or bump up elevation in our estrogen, progesterone, testosterone, or DHEA, but we see well within normal postmenopausal values, but it exerted a relatively potent beneficial effect on all 4 aspects of sexual dysfunction. So such data indicate that combined androgenic and estrogenic stimulation in the 3 layers of the vagina exerts important beneficial effects on sexual function in women without systemic action on the brain and other extravaginal tissues. So it's very local. And this was published in Menopause, the Journal of the North American Menopause Society, in 2009, so a good decade ago, and since continuing to see great research and continuing now even research in breast cancer patients looking at DHEA vaginally used in patients with breast cancer with great results. And so this study, which was published in Endocrinology Review in 2003, showed that in a series of animal models, androgens and DHEA have been found to inhibit breast cancer development and growth and to stimulate breast bone formation. So this is something we want to keep on board and healthy for the longest time, right? In general, just thinking of, okay, well, what do we need to do to help our patients live their best life, right? Avoid breast cancer, keep their bones strong and brain healthy, right? So that's important to see that. So this was looking at animal studies, and DHEA was found to inhibit breast cancer development. Additionally, DHEA was found to increase bone mineral density and to stimulate vaginal maturation without affecting the endometrium. So we have concern as gynecologists with estrogen unopposed to the uterus, increasing your risk of endometrial cancer. Well, DHEA and testosterone, as a matter of fact, did not stimulate the endometrium, but yet this improved well-being and libido with no significant side effects. Now, in this study published in Steroids 2 decades ago, showed that DHEA and the intracrine formation of androgens and estrogens had an inhibitory effect on the growth of human breast cancer xenografts in vivo in nude mice. So this really was one of the key articles that furthered the research in using DHEA as hormone replacement therapy for women. So for my clients, it's, using, again, just the tip of the iceberg, right, to address vulvar health, clitoral health, all the way down to the delicate tissue around the anus, et cetera, that women struggle with, hemorrhoids, fissures, et cetera. Keeping that healthy was just a concept that I knew as a gynecologist had to be addressed. And especially now that more people are talking about vaginal rejuvenation procedures, like, is this something that can be used with the Mona Lisa touch? Absolutely, absolutely. And for maintenance afterwards to get even better results. So we want to improve the health and condition of the pelvic floor as much as possible. So but in general, there's very few things that we can do naturally. So one thing as a gynecologist I've always recommended is, of course, Kegel exercises. So I wouldn't say do Julva, by itself. Also do your pelvic floor exercises. That's important. Another thing is being in functional medicine for all these years and big on nutritional detoxification. I wanted to make sure that Julva had no additives, no phthalates or parabens, no GMO, no estrogen, that it's all natural, gluten and toxin free, and it is. So I'm really happy to say that. It's soothing ingredients such as the shea butter, the emu oil, and the coconut oil all work together to moisturize, reduce those fine lines and wrinkles that can contribute to that loss of elasticity in the skin. The urethral area is particularly vulnerable to that. And many women will, just from the aging of the vulvar and urethral area, note post-void dribbling and that loss of urine when you cough or sneeze. And so it's something to consider. All right, and then I already mentioned the beautiful stem cells from the plant stem cells from the alpine rose, and this is an image of that beautiful flower, and adding DHEA and some vitamin E ingredients in there, and just the research showing the tremendous safety of the ingredients that I've discussed. Most of the ingredients have been around for eons, right? And not only that, and using it now in over 35,000 women, having used Julva, just the tremendous successes. So to just give you an idea, a wide range of ages. In fact, we have on my website at Cabeca.com, a beautiful story of Kathy, who's a 71-year-old woman who's sexually active once a week with her husband. They have their intimate time weekly, and that Julva has been a huge blessing to her and her husband, and just had changed their total lives experiences. So I encourage you to visit that on my website. And here are just some stories from Martha with her husband. She just said, Julva cream has played a big role in rejuvenating our intimate times. It's like that part of me is coming alive again. And then our younger clients, even in our 30s and 40s, just, showing a dramatic improvement in vaginal dryness and sensation, lubrication. Just in general, that I love, Alex says, who would have thought a cream could give me confidence in so many important areas of my body and life? Because women, if we're losing, it's bad enough to see a gray hair down there, but losing urine when we cough or sneeze, not enjoying pleasure and intimacy with our mate, we want to experience that. And so to gain that confidence again is just beautiful. And Natalie, she says, it's like caffeine for the vagina. It's a wake-up call. So she said, wowza, my orgasms are so much more intense. So what more can you say than that? And just an idea of like, how does Julva compare to water-based, silicone-based, oil-based, and other vaginal moisturizers out there? I mean, there's no comparison. So, we want to address those, and also keeping it clean and pure and all natural ingredients. And then again, Julva is a prescription formulation that is fabulous, and addresses even many more things with safety studies that we've looked at, and are able to compare with. One of the things we use are also, I recommend highly, pelvic floor exercises. These are Kegel balls. There are different ones that are available for women to use as well to help with pelvic floor exercises. But on my website, you can also refer your clients to my YouTube channel, and I have a video, the correct way to do pelvic floor exercises, and that's important. And just again, also remembering that, with non-hormonal treatments for vaginal dryness include coconut oil and Ayurvedic ghee and probiotics. And using probiotics orally as well as vaginally is absolutely okay, and actually preferred, because the vaginal pH and the microbiota shift. So keeping a healthy intestinal tract as well as a healthy vagina is really, really important. So I'll go ahead and take some questions now, if you have any. I also have some that are typical questions that come in that I can go over, but I want to just take a minute to address some of your questions as well. So, any questions, David or Doc, Frank, Rudolph? You can raise your hands, or I can bring you on, or if you'd like, I can go straight to bringing you back on, David. If you'd like, I can go straight to some of the frequently asked questions, or if you want to tell your wholesalers too, you want to share right now how they can be wholesalers with your product and where they need to go to do that.
Sure. That would be great. In the email that was sent out, there's a link where you can get some free samples and to set up your wholesale agreement. We'll send you 100 brochures so that you can start talking to your patients about it, have some patients get some experiences. That's the best way. I've given it to several people. They've already called back. We've seen some great results. And so that's the easiest way to get started. And then there's a very minimal amount that you need to order, a single case at a time to get started. And then the word of mouth will start to roll with your patients. And so we're really excited.
Yes, something a physician told me. I was speaking at a conference in Florida, and he came up to me, he'd heard me a year beforehand, and he goes, I started implementing what you said, and oh my gosh, it just, has totally changed my enjoyment in my practice. My patients are getting better, they're enjoying their life again. They're happy to see me, you know what I mean? And it just totally changes enjoyment of his practice. You get that feedback when you see like the light go off, the spark, the twinkle between a couple again. I mean, that just makes all the difference in the world. And there were no options that I had for my breast cancer patients. So, again, I'm small town, and I couldn't see them suffer. So I wanted to create safe alternatives versus the hands-off approach that is do nothing, definitely, like the do nothing does no harm. But I didn't feel like that was the right way to practice. So
well,
had to come up with
other
a
issue that
solution.
they have, it was really interesting. I walked into an OBGYN office last week, and Dr. Santiago was there, and she was, I walked up to the nurse's counter and I said, I've got a feminine rejuvenation cream that you should really know about. She went, what? I've been looking everywhere for that. She says, so, I really struggle with this. I try to get compounds done and I try to send them out and I have it done. And it's expensive, and so she said, this is really fantastic. This is what I've been looking for the practice.
Yeah.
They've got 3 practices here in Sarasota that they operate, and she's was really glad we came by. So she'll be ordering some product, and we gave her some samples, and the girls behind the counter, they were all receptive. She, well, you might want to leave a few more samples. So we'd like to have some samples too. So it went over.
Yeah, definitely give to your staff to try it, because they're your best advocates too, and they'll see a different. And so I'll talk a little bit about some of those things. How, when do people see results? What are the commonly asked questions? And David, tell them how to email you though, just so.
Yeah, it's dfederico@optiwellmd.com. If in the email that was sent out for this video, if you're on this video, there'll be a link where you can actually just click that link and it goes right to the OptiwellMD section, and you'll get all your materials. You'll be in queue, and then we'll ship you all your information and your brochures and your samples to help you get started.
Right. And so dfederico@optiwellmd.com. And then also on this call too is my assistant, Amanda, at drannacabeca.com. So if you have any questions too, Amanda is on my team to help you. So Amanda at drannacabeca.com. All right, David. So you think I should go ahead and answer some of the common questions that I typically see?
Yes, please.
All right, good. Okay. I'm going to move you back to attendee here.
Okay.
All right. Now share my screen again. So, all right, we've talked about Julva love, and the name Julva comes from my lack of imagination, but joyful vulva. Juicy vulva is what some clients have said as well. So we'll talk about that in a little bit, but that definitely are, some of the experiences. Where do you apply it? I always compare the vulva area to a orchid, right? The clitoral area, the labia majora, labia minora, the hymenal ring, and the urethral area. I mean, all the way. It's just a beautiful analogy, but just for our clients, they can apply it from the clitoris all the way down to the rectum. As we age, we get clitoral atrophy, and it's important to recognize that we'll see some clitoral atrophy as we age, and we want to address that early on, because it can get a hooded clitoris, which can be very painful and very uncomfortable for our clients. And also, not to mention, there are thousands of nerve endings to the clitoris. So we want to keep that area healthy and sensitive and responsive in a good way. I always emphasize that, reminding clients that you're doing your Julva to also do your pelvic floor exercises to get the best results. And I teach them this in a video online or on my website that talks about, the healthy way to do it. And then just the reminder for our clients to use it daily, because that's definitely part of the victory, right? Is when we use it daily. So let's see here. Or night, you can use it in the morning or at night. And some clients will use it twice a day. If they've had significant issues or atrophy, they may want to use it twice a day. So just consistently, and I typically say, you're going to see a difference in 1 to 2 months. Some clients will tell us after the first usage that they've had benefit, but others will say it took them a little bit longer. And so I say, don't give up. Some patients, I need to have them increase it to to twice a day, but that's very rare. And that's a client that maybe had other issues as well. So some of the other questions that I get often is about trying to remember some of my other questions that I get here. Let's see. Do you guys have other questions? Oh, sometimes what you'll see is an irritation the clients may experience as a side effect. What are some of the, negative experiences that clients will get will be as a side effect, some irritation or tingling. And that's because Julva is designed to work. It's potent and it's penetrating and it works, right? We're going to reduce those fine lines and wrinkles, do the anti-aging work that needs to be done. But so it's not unlike if you've used a new product like Obagi or a cosmetic, new skincare line, you're going to get a turning over of tissue. Well, that's to be expected. And that's okay. Just if it's uncomfortable, we don't want anyone to experience that. Just stop for 3 days, go back to half the dose. There isn't anyone I haven't been able to coach through using Julva and get amazing results with. So that's one thing. The other thing is when we're going from the Sahara essentially to the Amazon. So we're going from dry, cracked, irritated, or decrease in glandular production of their own natural moisture and their vaginal bacteria is off. We typically see dormant yeast resurface during that time. So you're going from the Sahara to the Amazon. Now these buggers, right, are just thriving. So you may see complaints of itching, irritation, and that could be a concomitant yeast infection. Julva did not cause the yeast infection. It's just dormant yeast now are flourishing because the environment is now more favorable. So we just typically treat with prescribe a diflucan. I typically use the 200 milligram diflucan 3 days in a row, just because yeast really is persistent, sometimes longer, sometimes not. And then along with a topical terconazole or monostat, that can be used as well. And that can really help just nick it in the bud. They're not going to keep getting yeast infections. And in fact, I've had a breast cancer patient named Sandy who is 68 years old and had breast cancer 10 years ago. And she just was struggling. Her and her partner was struggling with her symptoms of dryness, irritation, and recurrent yeast infections. So by improving the health of the vulva, and she's a golfer, so standing in the sweat for many days. So by improving the health of the vulva and her tissue, she hasn't had a recurrent yeast infection. So that's really important to understand too. The other areas that, our clients struggle with vulvar diseases. Now, Julva is not intended to treat any diseases, but patients with lichen sclerosis who are typically hard to treat have improvement of their symptoms because Julva just helps nourish that tissue that is otherwise so sensitive. So while it doesn't per se treat lichen sclerosis at all, it does help alleviate symptoms. So it's worth trying in those clients who have had vestibulitis, lichen sclerosis, et cetera, that have had difficulty and haven't done well on things in the past. And this can just help certainly from that aspect for the vulvar health and the surrounding tissue to keep that healthy, because the chronic steroid use tends to thin out that surrounding tissue, and then they suffer from that side effect of the steroid creams for the vulvar dystrophy or lichen sclerosis. So I want to encourage you to use that in those clients as well. Another question that we often get is, will it affect my partner? And so I want to assure you that, the amount of DHEA in Julva, we say a 0.5 ml, so a pea-size amount. So it's really a very, very small amount that your clients use, just a pea-size 0.5 ml. Apply that daily. And it has approximately 8 milligrams of DHEA in it as far as the quantity of that ingredient. So it's a small amount. So that's a dip in the bucket for our male patients. So no, it does not have any adverse effects to our male partner. And I usually will tell them it's perfect to use as a moisturizing, a moisturizer prior to intercourse or as part of foreplay, and can really help with sensation and sensitivity during intercourse. So I think that's really something to know. Plus, it's fine. Like, all the ingredients are absolutely edible. I always said in creating my formula, it has to smell good, taste good, feel good, right? So, so Julva does. You've got to try it for yourself. So if you have any other questions, you can type those in, or let me know, or comment below, or email us. For questions for me specifically, you can email Amanda at drannakabeca.com, and she'll get with me. Now, we have a hand up, so I'm excited about that. Doc, I am promoting you back to a panelist. And David, Rudolph, any of you out there that are on too, please, raise your hand and I'll bring you on video, and you can look as awesome on video as Doc here. Oh, wait, hold on. Let me unmute you, Doc. Hold on. Okay, there you go.
What a compliment. Your journey is just amazing. And I think, you're a testimony to the best in medicine. So I want to say that first of all. But secondly, is there any, from your experience, is there any conditions or medical diagnosis where Julva should not be used? I mean, it obviously works for most women for most everything. So is there any situations that you've seen where you as a physician would not recommend it?
Yeah, absolutely. I'm glad you mentioned that. I forgot to bring that up. But because there's a study that I read, I've perused the literature now for over a decade, but there was a single study that I read that looked at DHEA and tamoxifen. And if the DHEA serum level was over 90, it interfered with the works and benefits of tamoxifen. So I say that if you are on tamoxifen, discuss this with your oncologist before you decide to use it. Mm-hmm. In letrozole or Femara, I have not seen any interference. And typically, though, we're talking about serum DHEAS levels of greater than 90. And in our breast cancer patients, it's rare to see a DHEAS over 40, but you need to know what that is, and you need to know what the research shows so that you can adequately discuss that with the patient. So if they're on tamoxifen, I typically say no, unless your oncologist approves it and your DHEAS is being monitored, as well as your serum estrogens, et cetera. Mm-hmm. I think that makes a big difference.
Mm-hmm. Second part of that, as you were explaining that, thank you. Long-term use of this, is it prudent to measure DHEA sulfate levels in these patients, even though you're only using 8 milligrams in a pea-sized dosage?
You don't have to. I mean, when we're using topical, when we're using topical creams, it's unlikely to see it in the serum. Now, I think it's good to get if you're doing hormone testing periodically. I mean, I do everything I can to get patients' DHEA levels up to, in women, over 100, ideally over 150 to 200. Right. And so, I mean, I'm going to look at it in different ways. So I always say we treat the patient, not the labs, but definitely want to see those baseline labs. And again, I haven't seen any significant bumps in serum testing. Now, when we're looking at urinary testing, maybe through precision analytics or Dutch testing or salivary testing, we may see absolutely an improvement in DHEA, but not to high or elevated levels of concern, for sure. Perfect. The other thing is that with, when we're using, again, what we're using in clients, it shows that on the intrinsic cellular level that we see DHEA converting to testosterone and estrogen, but we're not seeing it on the systemic in the serum. We're not seeing it at any systemic changes per se, but the higher, if we have someone who's using it twice a day, we just typically don't. And typically with our clients, we use it, every day for 30 days. And then from there, do we need to bump it up, or just maybe it's 5 days a week for maintenance?
Mm-hmm. Okay, perfect. Thank you so much. That's great.
Yeah. Okay. Any more questions? Rudolph raised his hand. All right, Rudolph, I am bringing you on as a panelist. Oops, I brought David on. Hold on. Here we go. Rudolph, now I'm bringing you on as a panelist. Join the family here. Hi, how are you? Oh, wait, hold on. Let me unmute you. Okay, now I can hear you. Oh, nope, can't hear you. Do you have a headset? Are you on your phone? There should be in the bottom left a dial in via phone or dial in via audio. So I'm also going to pull up, while we're waiting, I'm going to pull up my other slides here. Let's see. Nope. Oh, Rudolph, can't hear you. Maybe exit out and come back in. And we'll see you on. David, do you have any questions, comments?
I did. So you mentioned about maintenance and once a day to start. Is that typical, atypical that you would do once a day for 30 days? The cream typically lasts for how long? It's a 2-month supply?
Yeah, great point. It's a 2-month supply. And we give your physicians the 7-night trial pack so that their clients can try it and they can have it available. But yeah, this is 60 ml. So 60, it should last for 60 nights. Right. So that's kind of, your guideline of how much to use when,
So you would use it once a day, every day for 2 months, or do you?
Yeah, I typically say once a day, every day for a minimum of 30 days till you get really good results. When you get your perfect results, and then maybe 2 months and maybe 3 to 4 months for some clients. Sure. But then to go to a maintenance dose, typically you can take, a day or two off a week and still maintain those results. Some clients, when they start decreasing the amount they're using, will also lose some of the benefit. So again, it's they have to have a maintenance dose and kind of make it a part of the routine. Just like for brushing our teeth or brushing our hair, we want to create that consistency.
Okay, good. All right, thank you.
Yeah.
Rudy, having any luck over there coming through?
Let's see. Let me look back on Rudy here. Nope, I don't. Wait, I see you, but I don't hear you. You want to type in your question? Okay, so the little Q&A box or in the chat box, if you can type in your question, that will be great. I did have some other questions and answers that I had, just how they can apply it. And I typically tell them, same precautions if you're using other hormone creams, is that you want to apply it with your fingers, or you can put it on toilet paper and apply it that way, but to massage it in as part of foreplay. But just like if you're using a hormone cream, bioidentical, wash your hands well, keep your towel separate, because like with any cosmetic creams, we don't want those ingredients being transferred to our children. So just kind of as a precaution in general, and that's just from the testosterone world, I just carry that over. And then the other question is, that I always get is the dosage. So I went over that. A 0.5 ml is about 8 milligrams of DHEA in the active ingredient. And and that, we do guarantee it. I give a 60-day money back guarantee. So that will apply to you and your team. So they would just bring back in the unused portion of the tube and we would replace it. So I think that's just really important that I know it works if we're using it, if we're troubleshooting any areas that they're not having trouble. I mean, there's a 60-day money back guarantee. And I tell you, we have, our return rate and I don't even know. It's minuscule. It sounds ridiculous. So yeah. So I'm happy to offer that. And extend that. And Trying to think of any other questions that we get. Can Julva be used by men? I get that. And absolutely, because it's a really penetrating, men can use it. The testicles, penis, it's fine, absolutely, to use it. And Julva is safe for use on any skincare. Now, I know that some of your docs that have the med spas, a secret thing is that you may not be able to see the changes that are happening down there, but if you're applying it to your lips, you will see those changes. Like many women will get the fine lines of aging lines around their lips.
Right.
Let me tell you, that's the, upper lips, lower lips. Julva is the answer.
Upper lips, lower lips. I love it. Okay, that's great. Well, that is really great.
Oh, the other question you may get is if they're on vaginal estrogen, should they stop the vaginal estrogen? And no, I mean, it can absolutely be used with that. So,
so with these procedures like the O shot, and does these really help enhance that as well, and the benefits they get from that?
Absolutely. Yep. Plus you're going to have better tissue to work with. And so I would do it 2 months before that procedure at this point. I used to do G shots and train physicians in G shots, so I don't have specific experience with the O shot, but I know improving the health, that, the urethral health, et cetera, is going to make a difference. And
so this could be a really good pre-procedure, pre and post, really, I guess.
Pre and post, absolutely.
Yeah, for those type of procedures.
Yeah, because also, we're, having to manipulate the vulva and the area, plus you want a healthy clitoris. I mean, what's for the clitoris? So we want to keep that tissue healthy, and, until we get stem cells injected directly into the clitoris, which sounds horrible. Let's keep using the Julva, right? And I mean, we can do that, but the other thing you had asked about who shouldn't use Julva, and I didn't mention, but I want to, if they're pregnant or breastfeeding, I don't recommend it. And if there's any vaginal infections or undiagnosed vaginal bleeding, then you definitely want to talk with your doctor before, using it. So
okay, good.
That stuff too.
Are you seeing any cases of women, because I do hear complaints from women that are not able to have orgasm during sex? Are you seeing any of that turn around? Is that, will it help in that area, or is that just something that's physiological that probably not going to help with?
Say that again.
Or psychological.
What was the question? Sorry.
Some women have trouble having orgasm during sex. Are you seeing this as possibly something that could help with that?
Absolutely. Yeah. And we're seeing it absolutely improve that. So, many of us complain of diminished orgasm, with aging, right? And sensation. And so we're seeing an improvement in orgasm and sensation and intensity with using this. And so, for whatever reason, it's increasing the pleasure, less pain, less discomfort, whatever the reason, it's working. And the other thing, we've had clients, 29-year-old testimonial who had a Mirena IUD and had lost orgasm and was experiencing dryness. And so she's been using Julva with fabulous results, recently got married, and the changes is significant. So, we don't think often about our younger patients, but they're having discomfort with sex, vaginal dryness issues, loss of orgasm, inability to have orgasm. So I think like where the benefit is in my years, like why I did the G shot too, was because that gives them an area for sensate focus. So I found that giving that area for sensate focus, using Julva as part of foreplay, using, focusing on the G spot, being able to, just have better presence during intimacy makes a lot of difference. And I think that's a really big part of it. One thing that, your clients can refer their patients to at no charge is my Help Doctor, My Sex Drive Has No Pulse video. And Amanda can send you a link to that, but it's drAnnaCabeca.com/help doctor. And it's a free hour and a half that kind of shares some secrets between men and women and why that our sex drive goes away, and debunks some of the myths, and also takes away, some of the guilt and shame that many women suffer with and struggle with as not, not having pleasure during intercourse versus understanding what's going on.
Very important. Well, thank you.
Yeah.
Thank you, Dr. Cabeca, so much for everything and enlightening us. And it's really a fantastic product. And we really appreciate you and all the work that you've done to create it.
Absolutely.
Thank you. I look forward to your feedback. And so we'll give you the link for this. And let me go ahead and I'll go ahead and stop recording. I know, like I'm not savvy when it comes to all this stuff, but